Ever feel a little tipsy, maybe even unsteady on your feet or slurring your words, but you know you haven't had a single sip of alcohol?
Yeah, sounds impossible, right? But it's actually a real thing.
The real thing. Get out of here.
No, really. It's this super rare condition called Auto-Brewery Syndrome. ABS for short.
Auto-Brewery Syndrome.
Or gut fermentation syndrome. Some people even call it drunkenness disease.
Drunkenness disease. Okay, so what is it? Like your body making its own alcohol?
That's basically it. Think of it exactly like that your body, well, specifically your gut, starts producing its own booze.
How on earth does that happen? It's not like you just swallow some hops and barley and...
No, not quite. It all comes down to the tiny little organisms living inside your digestive system, mostly in the small intestine. Bacteria and fungi.
Right, the microbiome stuff.
Exactly. Normally they're all in balance, but sometimes certain types, especially yeasts or sometimes specific bacteria, can kind of take over. Yeah, they grow too much. And when they do, they get really active, fermenting the sugars and carbohydrates you eat, turning them into ethanol.
Ethanol? Like the alcohol in actual drinks?
The very same. And then that ethanol gets absorbed into your bloodstream.
Wow. So it's literally like having a tiny hidden brewery inside you, and that makes you feel drunk.
Precisely. You start showing all the signs of intoxication, even though you haven't touched a drop of alcohol.
That sounds disruptive, to say the least. Why is it important for us, for people listening to understand this? It sounds so rare.
Well, it is rare, but for the people who have it, it causes huge problems. Think about it. You suddenly seem drunk at work. That could cost you your job.
Oh, man. Yeah.
Or imagine it happening when you're out with friends. People might think you have a secret drinking problem.
That would be awful. The suspicion.
Exactly. And worse still, you could get pulled over while driving and fail a breathalyzer test, leading to a DUI, all while being completely honest that you haven't been drinking. It puts people in an absolutely impossible situation, facing disbelief and serious legal trouble.
Being blamed for something your own body is doing without your control. That's just...
Right.
Yeah.
And because the symptoms can vary a lot and look like other things, it often gets missed by doctors. It's underdiagnosed.
So people could be suffering for ages without answers.
Yes, potentially for years. That's why talking about it, understanding it is so critical. Proper recognition and treatment can literally give someone their life back.
Okay. So that's our mission for this deep dive then. We need to unpack auto-brewery syndrome, figure out what causes this internal brewing, how you'd spot the signs.
The whole diagnostic journey, which microbes are usually the culprits, and importantly, what can actually be done about it.
All right, let's dive in. Where do we start? How does this internal brewery actually get set up?
Okay, so let's talk about the mechanism. Like we said, it's usually an overgrowth of yeast or sometimes fungal strains, mostly happening in the small intestine.
And they turn carbs into ethanol.
Right. They become hyperactive brewers, essentially. Think of your gut like a complex ecosystem, the microbiome and the mycobiome. When that ecosystem gets disrupted, that's when trouble can start.
What disrupts it? What throws that balance off?
A few key things. Taking antibiotics, especially for long periods or very frequently, is a big one. Antibiotics can wipe out beneficial bacteria.
Leaving space for the yeast or fungi to grow?
Exactly. They kill the competition, Diet is another huge factor. Eating lots of carbohydrates, especially refined sugars and simple carbs.
Is like giving them rocket fuel.
Precisely. It's the perfect food source for these fermenting microbes.
Makes sense. Like feeding yeast sugar to make bread rise.
Same principle. Then there are underlying health conditions. Things like diabetes, especially if blood sugar isn't controlled.
More sugar available for them.
Yep. Obesity, inflammatory bowel diseases like Crohn's, irritable bowel syndrome, conditions like short bowel syndrome where food isn't absorbed properly, or gastroparesis where digestion is slow.
Food hangs around longer, giving them more time to ferment.
That's the idea. Also, liver problems like fatty liver disease or a weakened immune system can make it harder for the body to keep these microbes in check.
Any other, maybe less obvious risk factors?
Well, there are a few interesting associations. In very rare cases, there might be genetic differences affecting how the liver breaks down alcohol, making people more sensitive. Stress, maybe even skipping meals, have been suggested as potential triggers or things that make it worse for some people. Previous abdominal surgery or anything causing food to stagnate in the gut could contribute. Poor nutrition overall can impact gut health too. And researchers have noticed links with things like alcohol intolerance, having candidiasis or thrush, and general metabolic issues.
Wow, okay. So it's really a combination of factors potentially leading to this gut imbalance.
It seems that way. And some studies comparing ABS patients to healthy controls found some interesting patterns.
Like what?
People with ABS tended to report poorer overall health, more food sensitivities, more GI symptoms like diarrhea or changes in bowel habits.
Okay.
They also tended to drink more water, less tea, coffee, or dairy, ate out less often. Also more non-food allergies, maybe longer courses of antibiotics in the past. Even things like pet ownership showed up differently in some studies.
That's fascinating. It suggests a whole constellation of factors might be involved.
It really does. There's even some early suggestion about mold exposure being relevant in some cases, and very recently researchers are starting to ask if there could be a link with prior COVID-19 infection, but that needs way more investigation.
Okay, so the gut environment gets unbalanced, these microbes overgrow. Can you walk us through the actual fermentation process? How does sugar become alcohol inside you?
Sure. So fermentation is just a process where microbes convert sugars into ethanol and carbon dioxide gas. Yeasts often use a pathway, the EMP pathway, to break sugar down into something called pyruvate.
Right.
Then enzymes convert that pyruvate first to acetaldehyde and then finally to ethanol. Some bacteria might use a slightly different initial pathway, but the end result involves producing ethanol.
And our bodies normally make some ethanol during digestion, right?
A tiny, tiny amount. Yes. Mm-hmm. Our liver usually clears that right up, no problem. But in ABS, the sheer volume of ethanol being produced by this microbial overgrowth overwhelms the liver's capacity to metabolize it.
So the blood alcohol level starts to climb.
Exactly. And that's what causes the intoxication symptoms. The root cause is typically that dysbiosis, that imbalance, letting the fermenters run wild.
And you mentioned a link to liver disease earlier.
Yeah, that's an emerging area. Research is looking into whether these ethanol-producing gut bacteria might actually contribute to the development or worsening of non-alcoholic fatty liver disease, or NAFD. So the impact might go beyond just feeling drunk.
Okay, the body's become a brewery. How would you actually know this is happening? What does this unseen intoxication look like?
Well, the really striking thing is how closely the symptoms mirror actual alcohol intoxication. But of course, without drinking any alcohol.
So like slurred speech, trouble walking.
Definitely. Slurred speech is common. Loss of coordination problems with balance, walking steadily, even fine motor skills like writing.
Okay.
Dizziness, feeling lightheaded, disorientation, confusion about time or place. Memory problems are a big one. Difficulty recalling things or concentrating.
And judgment. Does that get impaired?
Yes, impaired judgment, just like with alcohol. Mood changes are also very common. Irritability, anxiety, sometimes depression. In more pronounced episodes, you might see agitation or reduced inhibitions. Physical signs can include blurred vision, dilated pupils, maybe a flushed face. Nausea and vomiting can happen too.
That sounds bad enough. Does it get worse?
In very severe, though thankfully rare cases, it can lead to seizures or even coma if the blood alcohol level gets extremely high.
Wow. Okay, those are the classic drunk symptoms. Are there other, maybe less obvious signs associated with ABS?
Yes, absolutely. Chronic fatigue is a real common complaint, feeling exhausted even after sleeping.
Right.
Brain fog is another frequent one, that feeling of mental cloudiness, difficulty thinking clearly or focusing. Headaches, sometimes quite intense, are also reported.
What about gut symptoms, since it starts there?
Makes sense, right. And yes, significant GI distress is common. Bloating, excessive gas, diarrhea, abdominal pain, sometimes symptoms that mimic irritable bowel syndrome.
Okay.
Strangely, some people report hangover-like symptoms without drinking, and as we mentioned, sometimes there's an actual alcohol smell on the breath, occasionally described as fruity. Glassy-looking eyes might be noticed too.
Any others, even rarer things?
Less commonly, you might hear about dry mouth, dehydration, maybe even respiratory symptoms like a runny nose or cough. Food sensitivities often develop or worsen. And then there's a whole list of non-specific things sometimes reported. General mood changes, dysphoria, depression, poor productivity, blackouts, memory fog, delirium, excessive sleepiness or somnolence, feeling faint, incoherent speech, sometimes bizarre behavior, red skin, burping, that alcoholic stench again, fits of strange speech, very rarely visual hallucinations, intermittent fevers or chills, even swelling or edema.
That is a huge range of symptoms. It must be so easy to mistake it for something else.
Exactly. And, adding to the confusion, the symptoms often pop up after eating a high-carbohydrate meal, but the delay can be significant, sometimes up to 24 hours later.
So it can seem completely random when an episode hits.
Precisely. which makes it incredibly difficult for the person experiencing it and for doctors to connect the dots initially.
So if someone suspects ABS, how do doctors actually diagnose it? It sounds like a real detective story.
It really can be. It's often a challenging and long process because it's rare, and those symptoms overlap with so many other conditions.
Where does the investigation start?
It usually begins with a very thorough medical history. The doctor needs to ask detailed questions about diet, any history of frequent antibiotic use, and crucially, about these unexplained episodes of intoxication.
And a physical exam too, I assume?
Yes, a physical exam is important, and getting what's called collateral history, talking to family members or close friends, is often vital.
Why is that so important?
Because the person might be saying, I didn't drink, but appearing intoxicated. Family can confirm the episodes, describe what they look like, how often they happen, providing objective information.
Right, corroborating the story.
Exactly. Then, the doctor has to meticulously rule out other possible causes for the symptoms. Things like head trauma, certain metabolic issues like lactic acidosis, psychiatric disorders, and so on.
Okay, ruling things out, then what?
Yeah.
Tests.
Yes, laboratory tests are key. The absolute cornerstone is measuring the blood alcohol level, the BAL. Documenting ethanol in the blood when the person hasn't consumed alcohol is essential.
How do they measure that accurately?
Gas chromatography on a blood sample is the gold standard, the most accurate method. Breathalyzers can be useful during acute episodes or for monitoring at home, but the blood test is more definitive for diagnosis.
Okay. What else? Stool tests.
Yes, stool cultures are important. They look for an overgrowth of specific fungi or bacteria and can also test which medications those particular microbes are sensitive to, which helps guide treatment.
Makes sense.
Standard blood work, like a complete blood count and metabolic panel, helps screen for underlying conditions like diabetes or liver problems that might be contributing. And often, a drug screen is done just to be absolutely certain that secret alcohol consumption isn't happening.
I remember reading about a specific challenge test with carbs.
Ah, yes, the carbohydrate challenge test or glucose challenge test. This is often considered the confirmatory test.
How does that work?
Basically, you start with a baseline blood or breath alcohol level of 0. Then the person consumes a standardized high load of carbohydrates, often a sugary drink.
Okay.
After that, their blood and/or breath alcohol levels are monitored periodically over several hours in a controlled setting, like a clinic or hospital.
And if the levels go up?
If there's a significant rise in their BAL without any alcohol intake, that's strong evidence supporting an ABS diagnosis. The controlled setting is crucial to ensure accuracy and safety.
That sounds pretty definitive. Any other diagnostic tools?
Sometimes, particularly if upper GI involvement is suspected, doctors might perform an upper endoscopy, maybe even a lower endoscopy too.
Using a camera to look inside.
Right. It allows direct visualization. They can collect secretions or small tissue samples, biopsies, for culture to identify microbes directly from the gut lining. Finding significant fungal colonization, especially in the upper GI tract, can be a key finding.
And you mentioned home monitoring.
Yes, having the patient use a personal breathalyzer at home to track their levels, especially when symptoms occur, can be really valuable for correlating symptoms with actual BAC elevations and monitoring treatment response.
So it's a process of elimination, careful history, and specific tests to nail down this elusive diagnosis. Now, who are these microbial culprits, the usual suspects causing all this fermentation?
Well, like we've established, it's an overgrowth of these carbohydrate fermenting microorganisms. And yeasts are definitely the most frequently identified offenders.
Which kinds of yeast?
The number one suspect is usually Saccharomyces cerevisiae.
That's the bakers and brewers yeast, right?
Exactly, the very same one. So it's naturally very good at producing alcohol. Then various Candida species are also very common culprits. Candida albicans, Candida glabrata, Candida kefir, Candida parapsilosis.
Are there others?
Less frequently, you might see Saccharomyces boulardii, which is interesting because it's sometimes used as a probiotic. Candida tropicalis, Candida krusei, Candida intermedia, Torlopsis glabrata, which is actually now called Candida glabrata, and Clavieromyces marxianus.
So primarily fungal players.
Predominantly, yes. But bacteria can definitely be involved too. The most notable one is Klebsiella pneumonia.
Klebsiella, okay.
Yeah, it's known to ferment carbohydrates into alcohol, and as we mentioned, there's some thought it might even accelerate NAFLD.
Any other bacteria linked to it?
There have been at least single case reports involving others, like Enterococcus faecium, Enterococcus faecalis, and Citrobacter forndia.
So it sounds like it might not always be just one bad actor.
That's a really important point. ABS is likely quite complex, and it might involve a combination of different microorganisms working together or maybe taking advantage of the situation. The specific mix probably depends a lot on the individual's unique gut microbiome, their diet, overall health, immune status, lots of factors.
Which makes identifying the specific microbes through testing even more critical for treatment.
Absolutely. You need to know who you're targeting.
Given how strange this condition is, do we have any idea how common it actually is? Who tends to get it?
That's a tricky question. Officially, ABS is considered rare, but
You suspect it's underdiagnosed.
many experts do, yes. Largely due to lack of awareness among medical professionals, those non-specific symptoms we talked about, and unfortunately sometimes skepticism towards the patient's claims of not drinking.
So the real numbers could be higher.
Quite possibly.
Yeah.
We know it occurs worldwide. It was first described in Japan back in the 1950s. It affects both adults and children, people of all ages, both sexes.
Does it tend to affect healthy people or mostly those with other issues?
It can occur in otherwise healthy individuals, but it does seem to be more commonly reported in people with pre-existing conditions.
Like the ones you mentioned earlier.
Right. Diabetes, obesity, Crohn's disease, short bowel syndrome, and certain liver conditions like MS-LD or MASH-H seem to be associated more often. We know, for instance, that people with diabetes or cirrhosis often have higher baseline levels of endogenous ethanol anyway.
Any particular populations more affected?
There's limited solid epidemiological data, so it's hard to be definitive. There has been some speculation about a potentially higher prevalence of the Japanese population, possibly related to genetic factors in alcohol metabolism, but that's not firmly established.
Just how rare are the documented cases?
Well, a review back in 2020 looking at the English medical literature found only a relatively small number of published cases, which underscores its documented rarity. But again, experts familiar with the condition suspect the true prevalence is underestimated.
And you mentioned those interesting trends in studies comparing ABS patients.
Yes. Things like reporting poor overall health, more food sensitivities, higher rates of GI symptoms, different dietary patterns like drinking more water and less of other beverages, eating out less, higher rates of non-food allergies, and longer antibiotic use histories. These all hint at underlying health and lifestyle contributions, but we need more research to really understand these connections.
It really sounds like this condition could completely derail someone's life. What are the main consequences, the ripple effects, both short and long term?
Oh, the impact is massive. It affects physical health, mental well-being, social life, relationships, employment, and even legal standing. It's incredibly disruptive.
Let's break that down. What are the immediate problems during an episode of intoxication?
Well, the obvious one is the increased risk of accidents and falls due to impaired coordination and balance. Simple daily tasks become difficult or unsafe due to confusion and disorientation.
Right.
Blackouts can lead to dangerous situations or memory gaps. The psychological symptoms, irritability, poor judgment, reduced inhibitions, can strain relationships and lead to regrettable behavior.
And the mental toll.
Significant anxiety, depression, feelings of helplessness, even suicidal thoughts can arise from the distress and lack of control. Plus, that chronic fatigue makes productivity and quality of life plummet.
And the legal side you mentioned, the DUI risk.
It's a huge fear and a devastating reality for some. Being arrested, facing charges, losing your license, potential job loss, all because your body is producing alcohol without you drinking it. It's incredibly unjust and difficult to navigate.
What about long-term health? Is the body constantly producing alcohol damaging over time?
That's a major concern. The potential long-term effects could mirror those of chronic alcohol consumption. There's an increased risk of liver damage, fatty liver, potentially even cirrhosis or pancreatitis.
And that link to NAFLD-NASH again.
Exactly. There's also a theoretical risk, though not fully understood, that chronic exposure to endogenous ethanol could potentially lead to alcohol cravings or even alcohol use disorder, especially during or after treatment.
Really? Your body making it could make you crave it.
It's a possibility being considered. Some research also suggests potential impacts on nutrient levels, like vitamin B6, zinc, and magnesium. And while extremely rare, there's the theoretical risk of life-threatening alcohol poisoning if BAC levels spike incredibly high.
Beyond the physical and legal, what about the social damage?
It can be profound. The stigma associated with apparent drunkenness is significant. People might withdraw socially, feeling ashamed or afraid of unpredictable episodes.
And the accusations.
False accusations of closet drinking can destroy trust and ruin relationships with family, friends, employers. It becomes incredibly hard to maintain employment or participate in normal social activities when you can't predict when you might suddenly appear intoxicated. Isolation is a common consequence.
This sounds incredibly challenging, but there is hope, right? What can be done? What's the road to recovery look like?
Yes, absolutely. Treatment involves a multi-pronged approach aimed at getting rid of the microbial overgrowth, managing the symptoms, and restoring gut health. It usually combines diet changes, medication, and sometimes probiotics.
Diet seems key, given the carb connection.
It's the cornerstone, really. The primary goal is to starve the fermenting microbes of their fuel source. So a low-carbohydrate, low-sugar diet is essential.
Meaning cutting out things like bread, pasta, sugar.
Yes, avoiding simple carbs like white bread, rice, pasta, sugary drinks is crucial. Limiting even complex carbs like potatoes is often necessary. A higher protein diet is frequently recommended to help stabilize blood sugar and reduce fermentation potential.
How strict does it need to be?
Often, an initial very strict phase, almost carbohydrate-free, might be needed for several weeks, maybe around 6 weeks, to really knock back the microbial population. Then, carbohydrates, particularly certain fruits and vegetables, can be cautiously reintroduced.
It sounds like you'd need guidance.
Oh, absolutely. Working with a doctor or a registered dietitian is really important to ensure that diet is effective but also nutritionally adequate. And long-term, maintaining mindful carbohydrate intake is usually necessary to prevent relapse.
Okay, diet first. What about medications?
Drug therapy is often necessary, especially initially. If fungal overgrowth, particularly Candida or Saccharomyces, is identified,
Just common?
then antifungal medications are the go-to. Drugs like fluconazole, nystatin, sometimes others like micafungin or voriconazole, depending on the specific fungus identified by cultures and its sensitivities.
And if bacteria are the culprits?
Less common, but if specific bacteria like Klebsiella are proven to be the cause, then targeted antibiotics would be used. And of course, if someone presents with acute severe intoxication from ABS, they need immediate medical care to stabilize them, just like alcohol poisoning.
What about probiotics? Can adding good bacteria help?
They're often recommended, yes.
Yeah.
The idea is to help repopulate the gut with beneficial bacteria and restore a healthier balance, especially alongside or after antifungal or antibiotic treatment. Multi-strain formulations are often suggested.
Any specific ones?
Lactobacillus acidophilus is one that's sometimes mentioned as potentially helpful in suppressing ethanol-producing yeasts. While more research is needed on their specific effectiveness for ABS, probiotics generally support gut health and can be a useful part of the management plan.
Beyond diet and meds, any lifestyle adjustments?
Identifying and avoiding personal triggers, specific foods, or maybe high-stress situations can be helpful for some. Stress management techniques like yoga, meditation, or regular exercise might also play a role.
And avoiding things that disrupt the gut.
Definitely. Completely avoiding alcoholic beverages is critical. And being very cautious with antibiotics, only taking them when absolutely necessary, is important to avoid further upsetting the gut balance.
What about tracking things?
Regular monitoring of BAC levels at home with a personal breathalyzer can be incredibly useful. It helps the patient and doctor track how well treatment is working and catch any early signs of recurrence.
You mentioned fecal transplants earlier, FMT. Is that a real option?
It's generally considered for more severe, chronic, relapsing cases of ABS that haven't responded well to conventional therapies like diet and antifungals.
So last resort kind of thing.
Currently, yes. The idea is to completely reset the gut microbiome by introducing a healthy donor's microbiota. Early research is showing some promise for these difficult refractory cases, but it's still largely experimental for ABS.
It sounds like the understanding and treatment are evolving. What's on the cutting edge? What does recent research tell us? And what's the future outlook?
Yeah, research is definitely ongoing, though it's still an understudied area compared to more common conditions. The focus is on better understanding the exact mechanisms, improving diagnosis, and exploring new treatment avenues.
Any specific examples of recent work?
Well, there was a 2023 study looking specifically at the role of high alcohol producing strains of Klebsiella bacteria in ABS. Research continues to explore that connection between gut fermentation, elevated fecal ethanol, and glucose and liver disease like NASH. And studies are still trying to pin down precisely how diet, antibiotics, and those underlying health conditions interact to disrupt the gut microbiome in a way that leads to ABS.
How about advancements in diagnosis?
We're seeing refinements in the carbohydrate challenge testing protocols. There's increased use of comprehensive microbiome analysis sequencing techniques that give a detailed picture of the gut microbial community to identify imbalances.
More detailed than just cultures.
Potentially, yes. There's also growing recognition of the need for standardized diagnostic criteria to make diagnosis more consistent. And the use of home breathalyzers for monitoring is becoming more accepted and common.
And on the treatment front, any new developments?
The potential of FMT is a key area, with at least one phase 1 clinical trial underway specifically for ABS. Researchers are also comparing the effectiveness of different antifungal and antibacterial regimens and investigating the role specific probiotic strains might play.
What about the broader impact, the social and legal stuff?
There's definitely increasing awareness there. Efforts are being made to educate healthcare professionals, but also law enforcement and the judicial system about the reality of ABS. Continued publication of case reports and reviews helps build the knowledge base.
Any other new areas popping up?
One notable recent area, as I mentioned briefly, is exploring a potential link between developing ABS symptoms after a COVID-19 infection. It's the early days for that research, but it's something scientists are looking into.
So overall, the field is moving forward.
Slowly but surely, yes. Driven by the increasing recognition of just how important our gut microbiome is for overall health, researchers are paying more attention to conditions like ABS where that connection is so dramatically clear.
Okay, so to wrap things up quickly, Auto-Brewery Syndrome. It's this rare, often baffling condition where, due to an imbalance of microbes in your gut, your own body starts producing alcohol.
Right, leading to these unexpected episodes of intoxication, which, as we've discussed, can cause significant personal, social, and even legal turmoil.
It really underscores that incredible complex relationship between our gut health and everything else, doesn't it?
It absolutely does. And it makes you think, doesn't it, about the challenges of diagnosing these rare, often misunderstood conditions and how easily something happening inside us biologically can profoundly affect our lives.
A really fascinating and, for those affected, a very serious condition. If this deep dive sparked your interest, or if you have questions or thoughts you'd like to share, please do visit our website or find us on social media. Leave a comment. We'd always appreciate hearing from you.